Hi, my name is Donatella Massai, Senior Technical Lead of the RED Initiative from Johns Hopkins Center for Humanitarian Health. I'm a health specialist with 20 years of experience in complex emergency, ranging from Middle East to the Horn of Africa, West Africa, Latin America, and the Caribbean. I have worked in response to the health dimension of humanitarian emergencies in several epidemics such as cholera, Zika, Ebola, and now COVID-19 in humanitarian contexts. For the next 20 minutes, we'll be zooming on community health programming, and we shall be looking into what it is and why it is a key component of COVID-19 preparedness and response. We shall also looking at how, in turn, the COVID-19 pandemic is impacting community health. We shall describe the differences by transmission phases and concluding by examining the various applications of community health programming in different contexts. This module serves as an introduction to community health programming and provides an overview of its impact and the adaptation to COVID-19. This session comprises of 5 micro-training modules and are complemented by interviews with example of field application and adaptation. I trust that by the end of this brief introductory conversation, you would have refreshed your familiarity with the key elements of community health programming, particularly on aspects related to mitigation of COVID-19 transmission. You should also be able to explain the key element of and relevance of community health programming and identify how community health programming must be adapted to control COVID transmission. In the other 4 modules on community health programming, we will introduce you to the concept of prioritization of essential community health services, the role of community health workers in COVID-19, cross-cutting and integration opportunities into community health programming, and vulnerable and individual at high risk. Taken together, these modules should offer a condensed yet comprehensive review on community health programming in the context of COVID-19 and actionable references. Now, what is community health programming? Community health programming helps to increase direct engagement of community leaders and stakeholders to develop and promote lasting community health strategy that helps people make healthy choice where they live, work, and play. You are learning community health programming because it plays a fundamental role in minimizing morbidity and mortality and the social and economical impact of COVID-19. Individuals, community, the private sector, health and non-health organizations, and local authorities should all be part of community health programming response. We know now that the pandemic's impacts are exacerbated by limited resource and weak health systems. What are the key elements of community health programming? They are a package of intervention that can be put in place at country and local level. Adapted community health programming is about strengthening and enhancing services to deal with the impact of COVID-19 by using existing community resources to deliver essential services in collaboration with other sectors. Community health programming is a collaborative effort that operates through integration and cross-cutting modalities. It supports public health and non-pharmaceutical intervention in primary and secondary care facility and at household and community level. Non-pharmaceutical intervention are the action that, apart from getting vaccinated and taking medication, people and community can take to help slow the spread of the illness like COVID-19. Because COVID-19 is new, the human population has little or no immunity against it. These allow the virus to spread quickly, person to person, worldwide. Non-pharmaceutical intervention are among the best ways to controlling the pandemic when vaccines are not available. Why is community health programming so important? It is important because it strengthens and enhances life-saving services. To plan and carry out these services, community health programming rests on the engagement and active participation of the community. The processes of consultation is part of the share and participatory methodology conducted with local partners. Community health programming places the community at the center of its response and promote an holistic approach. It also establishes mechanisms of operational coordination between community and service provider in different sectors. In community health programming, intervention, for example, like infection prevention measures such as personal hygiene and household disinfection are implemented in alignment with risk communication and community engagement, education, health, and promotion, and other sectors aiming at reducing disease transmission in the community. Let's now see together the impact that COVID has on communities. The public impact of COVID-19 is expected to be more profound, where communities are already severely challenged by conflict, displacement, concurrent disease outbreak, and frequent natural disaster. In many countries, essential immunization services have been interrupted or are poor, increasing the risk of vaccine-preventable disease outbreak. Reduced accessibility to health services and disruption in health and food supply chain are among the impacts that are likely to result in greater excess mortality. Disease surveillance capacities are also stretched and unfortunately in low capacity and in humanitarian setting. The assumption is that COVID-19 will spread rapidly once the presence of community transmission. Utilization of health services has often dropped, even when those services are still maintained. The high prevalence of malnutrition, communicable and vaccine-preventable disease, in addition to a range of other social demographic factors, may impact the speed of transmission, especially during humanitarian crises. In addition to the direct impacts on individual and community health, COVID-19 caused major disruption to essential health and humanitarian service worldwide. Measures to control the spread of COVID-19 risk posing routine immunization and other preventive measures, leaving millions of unvaccinated children vulnerable to deadly yet preventable diseases. Rapid surveys done by the health cluster in Libya and Syria, for example, indicate that service delivery has been affected by measures such as movement restriction, leading to reduction in access to services. Loss of income due to imposed lockdown may further increase existing economical barriers to access healthcare. COVID-19 is also affecting the capacity of the authorities to provide essential services such as water provision and waste management, while these services are essential to control the pandemic. Beyond the impact of public health services on public health services, COVID-19 has triggered measures for its containment that are having a devastating impact on the life and the livelihood of most vulnerable people. COVID-19 may also trigger political turmoil, armed conflict, or forced population displacement. While community health programs may continue to function while limited support during some crises, they often stop functioning as challenges escalate. This is why existing programs need support to adapt community health programming to COVID-19. Now let's look together at this table. While we don't want to discuss specifically about HIV, hepatitis, and sexually transmitted infection, we want to show an example of the disruption of health services caused by COVID. As you can observe, this table clearly shows that more than 60% of the countries report disruption of health services. We now see how in a globally disrupted international supply chain market, many countries are challenged by the increased need for personal protective equipment, ventilator, and life-saving medication, but also routine supplies. This disruption has expanded rapidly to encompass both countries with fragile health systems as well as those with more advanced capacities. Why considering transmission scenario is important? Each community is unique and appropriate mitigation strategy will vary on account of the level of community transmission. Community health programming needs to adapt activities and services in accordance with the pandemic scenario. Mitigation strategy can be scaled up and down depending on the evolving of the local situation. WHO has defined 4 transmission scenarios for COVID. The first one, the scenario when countries report no cases. Scenario 2 and 3, when only sporadic or cluster of cases are detected. The fourth scenario is when there is community transmission. Some activity will remain constant no matter the phase of the pandemic. For example, community sensitization on how to recognize symptoms, where to get and seek help, and how to dispel fear, which could stop people from attending essential services, will remain regardless of the transmission phase. Well-defined and agreed upon essential services shall not be stopped. Mitigation measures should be adapted to the transmission scenario, and for example, canceling of gatherings will not be appropriate in a context where only sporadic cases are detected, or social distancing may not be sufficient in a context with community transmission when lockdown measure may be more appropriate. Now, let's discuss how to prepare, adapt, or delay services depending on the context. It is fundamental that we understand the centrality of community-based health intervention for the community and how it is critical in being able to prepare, adapt, or delay other work streams to accommodate the most life-saving activity or to prioritize essential services. Communities, their leaders, key stakeholders, including women who are playing a key role in community health programming, should all be involved in a facilitated process to decide what services, intervention, and delivery channel should be prioritized, adapt, or delayed. This definition process should be consultative and involving a wide variety of stakeholders. This is especially important in defining what non-essential service must be delayed and to identify triggers for resumption of early recovery. Government authority may issue guidance regarding, for example, temporary closure of school, but there may be other humanitarian activities that are not fully taken into account by the authorities, and these should be discussed and appropriately addressed at local level. In the next 3 slides, we are looking into specific aspects on how to prepare, adapt, and delay activities. Let's start on how to prepare. Throughout the COVID-19 pandemic, it is likely that community will go through many different transmission scenarios. This means that to ensure a continuity of community-based health services, communication and coordination among humanitarian actors, including all clusters and subclusters, must increase. Coordination at community level also needs to be enhanced so that the activity of all partners align with what has been considered essential by the community. Preparation at community level needs to anticipate the needs for services to meet the demand. The revision of the supply chain and stock of necessary medication equipment need to be factored in the preparation phase. How to adapt? Proper adaptation may require a sudden expansion of essential services. In community already under-resourced, this cannot be achieved without the community taking charge in the identification and delivery of those essential services. Adaptations also include an active community participation role in the expansion or transfer of service from institution to community and home-based setting. Risk communication and community engagement should support these processes and facilitate accurate and accessible information on how community can take ownership of mitigation measures and health outcome in their own hands. Rumor management, contact tracing, community-based surveillance and reporting would also be essential for community resilience. Adaptation measures must also include the training and support of community actors to ensure quality of response and associated services. Similarly, the adaptation and enhancement of existing community-based services with COVID-19 detection, prevention, and management activities should be pursued. Finally, what can be delayed? The continuation of all services cannot be guaranteed in the context in which capacity are severely strained. As mentioned already, essential services need to be prioritized in face of competing demands. The delay or suspension of these services should not be seen as a systemic failure, but rather as a part of a community response strategy. This is particularly relevant in the case of school closure as a measure to reduce the transmission. In this scenario, the community is called to match the discontinuity of in-person learning with alternative community mechanisms such as homeschooling or alternative learning methodology. Even the delay of service call for participatory process informed by scientific evidence in which the selection of service to be delayed is defined and adopted by the community. This process of community consultation and coordination need to be communicated to all partners, so to maintain coherence of approach and the respect of the community decision-making process. Let's look at integration of community health programming response. Regardless of the service area, community health programming and community engagement are essential components that cut across all areas. The health status of a population is impacted by multiple factors, far beyond the provision of preventive and curative health services, and integrated programming is essential for a coherent and effective humanitarian response. Additional factors directly impacting morbidity and mortality in a humanitarian emergency include availability of water and sanitation, protection, food security, and preventive and curative health and nutrition services. It is therefore important to establish a shared understanding among all sectors of the different processes and cross-sectoral elements to promote the integration of key activities and contribute to their effective implementation. An exhaustive description of cross-cutting approaches into community health programming will be provided separated in a dedicated module. We have now reached the end of our first module. We hope that through this presentation, we have been able to identify what is community health programming and why it is an important element in the different scenarios to mitigate the impact of COVID-19. Community engagement requires a robust communication strategy, and we trust that the example that we have provided reinforce the importance of the transparent consultative process led by the community. In closing, let's emphasize that the overall success of the response depends on the synergy between community and other service providers, where each of them mutually reinforce the other. Thank you for your attention, and please stay safe.